right. Good evening, everyone, and welcome to the Renew a Life After Cancer Education series. This is the first of 5 classes in the series, and this one is entitled Surviving Now What? So just happy that everyone could join us this evening. So the session this evening will be approximately an hour to an hour and a half, depending on the number of questions we have. Just want to let you know that this session is being recorded. So we will share this recording with you following the presentation, and then we'll also be sharing the slides with you. So just a couple of housekeeping items. We just ask that you keep your microphone on mute during the presentation. There will be an opportunity to ask questions, and then you can also put questions into the chat as we're going along. You may turn on your camera or you may leave it off. It is up to you. So following the class, probably on Monday, I will send out a copy of the slides, the recording, and then also a feedback survey. So the survey kind of helps us guide the next round of classes, and if there's any feedback that you have to share, we'd be happy to accept it and see how we may improve on the presentations, and then we can just make changes from there. So the program that you're joining is called Renew. It's to go through the next steps after cancer treatment, to kind of go through the long-term physical effects, the emotional and psychological concerns, and then we also share some resources with you to help try and guide your journey as you continue on after treatment ends. So the learning objectives: mainly what to expect after treatment has ended, how to identify the different physical, emotional, and psychological effects, and some tips on how to deal with them, and then sharing community resources with you. So just a little bit of background on the Renew program. So it's a 5-part educational series, and previously was an exercise program as well. Unfortunately, we're not able to host exercise classes at this time, but we hope to get those going again in the near future. So this program is focused on resources, education, nutrition, exercise, and wellness, and that makes up Renew. So it was developed by the cancer program, content informed by research, literature, trends, best practice, and from hearing from patients and family like you. So the different sessions, so there's 5 in total. You're free to attend any or all of them. If you're not able to attend the session, we do send out the information to anybody that is registered. So if you have it only registered for the one session, you can still register for the others. Even if you can't join us live, we will send you the information. So why is this important? We want to help you understand the next steps in your journey and prepare you for returning to healthy living, and empower you with information to help you through the next part of your journey. So tonight's session is with Kit McCann, nurse practitioner here with the oncology program. And Kit has been with the program from the beginning, and she's always got some really great information. So without further ado, I'll pass it over to Kit.
Thanks, Shannon. Welcome, everyone. Great to have you, even virtually. Hopefully, we'll be back in person at some point. But just wanted to say welcome. And by way of introduction, Shannon, thank you. I am a nurse practitioner here in the program. But what I am not is a cancer survivor. So my experience comes from working with patients like yourselves, and truly you are the experts in this subject matter. So happy to hear from you and learn from you as well. So we're going to be focusing on your next steps in your cancer journey. You've been through a number of these stages and maybe finding yourself somewhere around 5 or in between 5 and 6. and having some questions about what is it that you need to do to prepare to live well after cancer journey. Next slide. So your next steps. People always tell us that when they finish treatment, it would just be really good. But what we learned from patients is that number one, they realize it's not always over. Sometimes there are some long-term side effects, both physical and psychological. And also sometimes people have trouble moving on from being seen here quite frequently to kind of the space that comes when you're done treatment. And questions like, you know, like what should I go back to doing? How soon should I go back to doing it? These pose challenges for some people in their survivorship phase. Next slide. We say, who is a survivor? And we like to include anyone who's been diagnosed with cancer from their time of diagnosis through the rest of their life to be considered survivors. We consider the family members, friends, and caregivers also part of that survivorship experience. And what we also have learned from survivors that not everyone loves the term survivor, and that's okay. We use it because it kind of best describes who we're talking about, but doesn't mean you have to subscribe to that term either. Next slide. Big question is, will I be normal again? And what we don't know for each individual is what is normal after cancer treatment. You may have been told what to expect early on in your treatment or before starting treatment, or you may have had some good preparation moving into survivorship. But oftentimes patients will still have unrealistic expectations of what is to come following the discontinuation of treatment. And for many, this really leads to a great deal of worry. Next slide. So our first piece of advice is really to make sure you're getting follow-up care and even better, getting the right follow-up care. So this will depend on the type of treatment that you had and kind of complications or no complications that happened along the way. And there are established guidelines for follow-up, and that's based on the disease type and the treatment type that you had. And so your oncology team will be able to tell you what your survivorship plan or your follow-up care should look like in terms of how often do you get mammograms or prostate exams, and how often do you do blood work, and what is the appropriate interval for follow-up. We know for certain that when survivors get involved in their care, they feel like they have regained some good sense of control and the outcomes are better. Next slide. Here's a few questions people have about follow-up care. Wondering, should I tell my doctor about symptoms that worry me? Sometimes we're not sure if they're related to cancer or not related to cancer. Or sometimes we feel every symptom we ever experience from the time we're diagnosed is cancer related or a sign of recurrence or something like that. And so really, what should we be talking about? Who is the right doctor to see and for what reason after treatment ends? What tests do I need? And what can be done to manage some of the longer term side effects like pain, fatigue, or other problems you may be experiencing after treatment? People want to know, next slide, how long will it take to recover and feel more like yourself again? Is there something you can do to prevent the cancer from coming back, and what supports are available? So hopefully in the course of this discussion tonight, we'll be able to answer some of those questions. Fear of the cancer coming back is very normal and is experienced by almost every single survivor. Next page. In terms of a survivor's wellness plan, so we really encourage you to put together your own wellness plan, and this will help you to know what it is you need to do to reduce chances of cancer coming back or reduce the risk of a new cancer. It will allow you to take a look at how you can take care of yourself and continue or start living a healthier life if that wasn't your life before. And we want you to take into account your physical, emotional, social, and spiritual needs. So while you may present to your oncologist for follow-up with some physical symptoms, it may be another provider that you need to see to take care of some of the emotional or spiritual needs. Next. What we suggest that you talk to your healthcare provider about, and in your preparation for your visits, is we want you to talk about what are some of the new symptoms, any pain you have that is troubling you, any physical problems that you have that are getting in the way of you moving on in your life. So lack of energy or stamina, difficulty sleeping, sexual problems, weight loss or weight gain, inability to gain or lose weight, and then any other medical problems that have come up since you have been discharged. Also want you to talk, next slide, sorry, talk about medications, vitamins, and herbs that you may be taking as alternative treatments, whether you were taking them all along or this is something new. For sure, focusing on emotional problems, anxiety, depression, for example, in order to get you hooked up with the right team members that can help impact that. And then any changes in family medical history, and in particular, cancers, new cancers in the family since you finished treatment. So that we can have an overview of what may be some of the genetic cancers, which you'll have a whole session on. So we're going to take a quick look here into some of the long-term effects of treatments. And I'm certain that as we go along here, some of you will kind of be nodding or thinking, yes, this is me, or yes, oh, I didn't realize this could persist after treatment. So next slide. The first is fatigue. And I would say almost everyone experiences some level of fatigue. It is the most common complaint during the or symptom of experience during the first year after completion of treatment. Fatigue is different than being tired. So in the fatigue that follows cancer therapy, the rest you get or the sleep you have on a nightly basis doesn't cure this kind of fatigue. You still wake up feeling fatigued. Doesn't always follow a normal pattern. It most often gets better over time, but there may be a continued feeling of energy loss over years to come, which can be very frustrating. But there are coping strategies that we can talk about. And so, you know, initially we suggest that you plan your most important activities at the time of day where you have the most energy. So if that is when you wake up in the morning, or after you've had a meal, or after you have an afternoon nap, wherever you find to be the most energy-filled part of your day, then to put your important activities there so it can be done with the least amount of fatigue disturbance possible. We suggest taking naps. For sure, do what you enjoy, but maybe you do less of it if fatigue is a problem. And exercise really is the biggest thing you can do to combat fatigue, which sounds kind of crazy. If you tell me you're tired and I tell you you should exercise, you'll think I'm crazy. But the consistent practice of exercising, and that is raising your heart rate for cardiovascular exercise, really does combat fatigue over time. Next slide, memory and concentration. 1 in 4 survivors report memory attention problems after treatment. So chemo brain and brain fog are real things, and you may have experienced that during treatment. And I would say, while this statistic is a little bit old, and it was reported that about 25% are reporting memory, attention, and problems after treatment, I would say it's likely much higher than that. And this manifests in a difficulty paying attention, sometimes trouble finding the right words or remembering new things. And this may have been happening all along during treatment, or it may begin soon after treatment ends. Next slide. Pain. This is something we're going to want to talk about because there are different types of pain, and we really need to find the source of it to get to the bottom of it. So some examples of pains that you may be having after treatment are numbness in the hands and feet due to injured nerves. That's neuropathy. Scars from surgery. Maybe there is a missing organ or limb, or, for example, a breast that is causing some pain. Or there may be pains from other conditions that are actually not related to your cancer, but we need to be able to tease that all out to determine what is the source in order to eventually come to an ability to figure out how to treat that pain. Next slide. Neuropathy is that numbness that we talked about, and this is treatment-related damage to the nervous system, and chemotherapies can certainly cause some damage to the nervous system. In terms of neuropathy, nerves are the slowest healing part of our body, and so it does take time, which can be very frustrating. Neuropathy can also be made worse by other conditions that you may have already had prior to a cancer diagnosis or may develop during treatment, like diabetes, kidney failure, alcoholism, and malnutrition. Most times you're going to notice the pain in your hands or your feet, and it usually starts with the tips and then moves upwards. Next slide. Common symptoms are described. People will describe tingling, burning, numbness, sharp stabbing or electric pain sensations, And sometimes you'll notice, especially in the tips of the fingers or the bottoms of the feet, that there's a loss of sensation to touch. And so you have difficulty appreciating temperature or sharpness. With the feet getting neuropathy, there may be a clumsiness. Some people tend to walk like they have block feet, causing a little bit of clumsiness. Maybe some hearing loss, jaw pain, constipation, because the nerves that impact the bladder and the bowel can also be affected. And then, as I said, decreased or increased sensitivity to hot and cold. Lymphedema or swelling is when there is swelling in a part of the body, which is caused by a buildup of lymph fluids. We usually see it in the arms, legs, face, or neck. It can be mild and short-lived or occur months or years after treatment. It can be painful. There are treatments for lymphedema and swelling. If there have been lymph nodes removed in cases where there are, for example, a breast cancer where lymph nodes may be removed in the armpit and down the arm, you may end up with lymphedema in an arm. But also anyone who's had some abdominal surgeries that require lymph node dissections can also get lots of lymphedema in the lower extremities below the area of the surgery. You may run into trouble if that area gets burned or there's an insect bite. Any need for inflammatory cleanup cells to get there can cause some more swelling. And this can be quite uncomfortable for some people. And part of your discharge from cancer treatment would be to learn how to manage lymphedema. Next slide. So again, in terms of being at risk for lymphedema, breast cancer patients that have had lymph node removal in the armpit or arms, or radiation or radiation to that site. In terms of melanoma with node dissections, prostate cancers because of surgery or radiation to the pelvis, cancer of the reproductive organs, the ovaries, or the endometrium. So treatment may involve lymph node removals. And this is kind of the abdominal surgeries that I talked about that could lead to some lower extremity swelling, and any cancer that may have spread to the abdomen where there's lymph nodes involved. So there are things that you can do, and it would be important to be set up with someone who manages lymphedema in terms of massage or treatment, learning how to keep it, avoid sunburns and insect bites and all of those things. Making sure your diet is protein rich is also another way to help that. We also may see mouth or teeth problems, and this is actually quite common in patients after treatment. So almost all people who've had radiation therapy to the head and neck, or people with bone marrow transplants because of certain medications that we have you on after transplant, can run into problems and difficulties with mouth and teeth, like early decay, gum disease, and it's about 2 out of every 5 people treated with chemotherapy have some difficulty. One of the other problems is that we often can't do extensive cleanings or dental work during treatment because of low counts, risk for infection, risk for bleeding, etc. So these things tend to be put off a little bit. Next. Some of the other problems involving the mouth or teeth include dry mouth, like I said, cavities and other tooth problems, changes in taste, painful mouth and gums. So some people get mouth sores during chemotherapy, but even continue to have some painful tingling or pain in the gums after treatment. Infections of the mouth and jaw stiffness or jawbone changes. And we see that a lot. If you've been on the bone builders that we use during and after chemotherapy, there's a problem that can happen in the jaw and will often require you to see a dentist prior to starting treatment. One of the things we do suggest is making sure that if you are wearing dentures, that they remain well-fitting. Oftentimes people have weight changes, either gain or loss during treatment, and having dentures that don't fit properly can cause some rubbing and chafing in the gums, which can lead to some bleeding and infection as well. Next is weight changes and eating. So again, this goes across the gamut. Some people will have difficulty gaining weight, keeping their weight on in terms of nutrition and protein during treatment. Others will have weight gain and have difficulty losing weight. And so in both cases, the goal is to work at managing a healthy weight, especially post-treatment, once the treatment is completed and we can actually work on, nutritional beneficial nutrition and gaining weight or losing weight if needed. Also, next slide, difficulty swallowing can be an issue for some people. Again, any radiation in the neck or throat area, and that can cause, for sure, difficulty swallowing, but chemotherapy as well in terms of mouth sores or other changes to the mouth that may make it difficult to swallow. Surgery involving the larynx may also lead to this same problem, and it's rare, but anyone who's surviving a cancer of the larynx will have probably the help of a speech language pathologist to try and swallow and prevent choking. Bladder and bowel control, we did talk about this in terms of neuropathy. And for sure, this can be one of the most upsetting issues after cancer treatment. For sure, it makes returning to social settings and family functions difficult, and leads people to want to stay home or be close to the bathroom. This can happen during treatment for sure, but after treatment, when the treatment has involved bladder, prostate, colon, rectum, ovaries, as well as other major abdominal cancers. And what people tend to experience is that they don't have control over their bladder or bowel. So there may be accidents or frequent trips to the bathroom required. There are medicines that can help. It's important if you're experiencing these symptoms that you have a discussion. Of course, we always need to rule out an infection, which is likely treatable, and then determine what is causing bladder or bowel dysfunction and be able to get to the root of it so that we can manage those symptoms for you. Next is menopause symptoms. And so women undergoing treatment for cancers may stop getting their periods every month or completely altogether. There is a change in the amount of hormone in the body depending on the treatment type. In some cases, for women who were premenopausal at the time of treatment, they may be kind of thrown into a chemical menopause or a surgical menopause, which also leads to a loss of fertility. And this is something that can be very upsetting. And for sure, women need to mourn the loss of their fertility as it's coming because of something they did not choose and have absolutely no control over. Next slide. So if having to have a cancer diagnosis and go through treatment and deal with the side effects of chemotherapy isn't enough, now some women may also be dealing with the onset of menopause and the symptoms that go with that, including irregular periods, hot flashes, vaginal or bladder problems, desired interest in intimacy, fatigue and sleep problems, most notably inability to stay asleep, memory problems, depression, mood swings, and changes in body composition like abdominal fat and skin thinning, hair changes. Next slide. So many people will experience, and not just women, both men and women will experience body changes, which can lead to some changes in intimacy during and following treatment. For sure, physical looks may be a big concern after treatment. Some changes are visible, causing body change and intimacy changes, but others are not. We do know that some people feel very ashamed or afraid to talk about these openly or actually address them with healthcare providers. But for some, it's troubling enough that you feel, it is worth the discussion, especially if it's leading you to feel bad about your body, because that in addition can lead to changes in desire for intimacy. And this we know can be very hard on your partners and loved ones, especially if it's not something that you're comfortable having an open discussion with. And so there are tips like, first and foremost, we say mourn the losses of fertility or drive or whatever the loss might be. Focus on some ways to cope with the cancer that has made you stronger and wiser. Look for new ways to enhance your appearance in terms of, makeup, haircut, clothes, something that makes you feel good. We used to have this program called Look Good, Feel Better. And it really was a great way for anyone to come and learn to enhance their looks in terms of doing something for themselves that does make them feel better. And most importantly is recognizing that you are more than your cancer. You have worth and value no matter what body changes or intimacy changes have happened as a result of your treatment. Next slide. Half of women treated for breast and reproductive organ cancers and more than half of men treated for prostate cancer report long-term sexual problems. So again, if dealing with cancer diagnosis and treatment isn't enough, this sometimes is not something we prepare people well enough for in terms of survivorship, that things don't always go back to normal. And patients will tell us they just weren't prepared for these changes. And for many, it was something they looked forward to in terms of returning to some sort of a normal life, only to find out that there are some changes in sex life that, next slide, may have been related to the surgery, the chemo, medications, that also come with their emotional issues, maybe come with or caused by anxiety, depression, guilt, changes in body image and stress. And so these are really important things to have a discussion with your healthcare provider. I can tell you as a healthcare provider for certain that if you don't bring it up, it likely won't get brought up. And so if there are things that are on your mind that you're thinking about, then you really need to ask the question or bring it up as a symptom so that it can be addressed. In the very least, it can be we can get you into the hands of the proper people to deal with these things. Next slide. Other sexual concerns in terms of treatment would be worrying about intimacy after treatment. Do things work the same? Does it feel the same? Is it going to feel different? Is the emotional connection still there? In terms of surgeries and other things, not being able to have sex as you did before treatment and diagnosis. Menopause symptoms and the cause and the changes they cause in body and body function. Loss of fertility, which we did touch on. Erectile dysfunction is very common and also can last well into survivorship because of certain medications. And so that's why it's important to talk about this, because there may be a medication that you're on that is leading to some erectile dysfunction that can be switched, changed, or maybe there are medications to help in terms of erectile dysfunction that your provider can help with. This can cause relationship strain, undoubtedly, especially if couples are not comfortable talking about these issues, and also especially if you weren't prepared from them in the beginning, so that when you think that you enter into survivorship, everything is just going to be back to normal, and this just adds one more layer of concern that you weren't expecting. Next slide. And so some of the tips that we have for addressing intimacy with after your treatment are being able to talk with your partner about your fears, the changes, what your needs are, being proud of your body for getting it through cancer treatment despite the changes that may be happening. Thinking of things that help you feel more attractive and confident, learning to touch each other maybe in different ways than you did before, and for sure being open to change, because that it may be required that things have to be done differently than they were before to achieve the same level of intimate satisfaction. Next slide is fear of cancer returning. And if we were in a room right now all together, everybody would be shaking their head. It's not something that I think anybody escapes. And it usually happens when there's symptoms or something normal is happening to you. And your mind first and foremost goes to, is this cancer returning? Very strong during the first year after treatment, especially strong for anyone who's had a recurrence or a relapse during their treatment. However, if we leave this fear uncontrolled, it can rob you of your ability to enjoy life. And we know that it naturally decreases over time, but certainly speaking with a qualified professional or a support group can also help to decrease it in a better time frame than letting it go. We talk about trigger events, and we probably don't prepare patients well enough to deal with these trigger events. And sometimes you don't know your trigger events until they're upon you. And it might be something like you wake up and realize the date is the same day you were diagnosed, or the day of a surgery, or it may be the anniversary of finishing chemo, or it might be somebody who was diagnosed at the same time of you that passes. So there's these trigger events that bring you back to that thinking of the fear of recurrence and life with cancer. And we really do need to address these, especially if they're causing, kind of more fear and anxiety and depression than they should. In terms of coping with your fear, be informed, understand what are the chances of relapse, what are the signs of relapse, what are the normal things that can happen. Be able to express your feelings of fear, anger, or sadness. You are not abnormal for feeling this way, for sure. Look for positive things. So sometimes it means looking for something good, even in a bad time, or trying to be hopeful instead of always thinking the worst. Don't blame yourself for your cancer. Some people believe that they got cancer because they did or did not do something. Remember that cancer can happen to anyone. You don't have to be upbeat all the time. And this is really important because there's this kind of feeling held by some survivors that, well, I beat cancer, I should be grateful and happy all the time. And then you have some down days and you feel a little depressed, or you have some anxiety, and it doesn't feel like it's okay to feel that way. And that's wrong. You don't have to be upbeat all the time. You weren't upbeat all the time before you had cancer. You don't have to be upbeat all the time after, but we do need you to find ways to help yourself relax, find joy, and be able to get over the down days that come. Being active is the number one, as I mentioned earlier, number one way to combat fatigue, fear, anxiety. Exercise is incredibly good on a physiological and a emotional level. And for sure, in terms of coping with your fear, looking at the things you can control and deciding very quickly to put aside those things you cannot control, and to work on the things that you can, to give you that sense of power and control over yourself, but also to help you to find some joy in what you're choosing to worry about. Depression and anxiety is very common. Obviously, this can continue from time after treatment. And for some, it might not even start until after treatment. You may have been so busy worrying about treatment side effects, blood counts, whatever it is, that this wasn't an issue. And then when treatment finishes and you think that everyone thinks you should be upbeat all the time, you start feeling really, really low and reeling down. These symptoms may start interfering with your daily life, and that needs to be addressed. You need to speak to somebody who can help counsel you through this, put some understanding to the experience you've had, and maybe even some medication to help change how the brain is working after treatment. So how do you know if you need help? So this is kind of like a general guideline that says, if you have any of the following signs or symptoms for more than 2 weeks, we'd like you to talk to your healthcare practitioner. And this might be your primary care physician. This might be another specialist. It might be your cancer team, a social worker. So some symptoms could be due to physical problems that are easy enough to change, like medications, changing the timing of dosing, for example. So it's really important to be able to talk about them to see what's causing what, and to get to the bottom of it and see if there's any way of improving it. So the following next slide is the following symptoms for more than 2 weeks. Then we need you to get some help. And that's feelings of worry, anxiety, or sadness that just doesn't go away. You're living with it on a 24/7 basis. Or feeling so anxious that you are just emotionally numb. Feeling overwhelmed, out of control, feeling shaky might be a physical manifestation. Having a sense of guilt for surviving when others have not, or feeling completely unworthy of your chance to become a survivor. Feeling helpless or hopeless, for sure. Any thoughts about suicide or self-harm need to be addressed quickly. Noticing yourself getting more short-tempered or moody, or people around you telling you that they're noticing that. And then difficulty concentrating or feeling scatterbrained. Sometimes that feeling of overwhelm takes over and you just can't formulate thoughts, make decisions, or finish sentences. if you're crying for long periods of time or many times each day, when all you can focus on is the worry or the problems, or you're having a hard time getting certain thoughts out of your mind, if you're finding it hard to find any enjoyment in the everyday things such as food, meals, being with family, friends, you find yourself avoiding situations or things that you know are really harmless, not going out, not being around people, and for sure, again, if you're having any thoughts about hurting or killing yourself, it's time to take action. Next slide is some of the physical signs of depression and anxiety. So you may be experiencing some unintended weight loss or weight gain, sleep problems, such as not being able to fall asleep or not being able to stay asleep, or you might be so depressed that you're sleeping way too much, not wanting to get up, having a racing heart or dry mouth, increased perspiration, sweating, upset stomach or diarrhea that is kind of happening on a more constant basis, or you're physically slowing down because you just can't manage. Fatigue that doesn't go away. It might include headaches or other aches and pains. For sure, these are things we want to talk about so that we can get you the help that you need. In terms of relating to others, some people find this to be a really difficult issue after completion of treatment and trying to return to their normal. And this is where it might start to affect relationships where you just don't, you feel like people can't understand you, or you don't know how to relate to them, or you don't know how to have conversations. People will have difficulty relating to family, friends, and coworkers that once it was so easy to be around at one point. We do see a lot where returning to work may be challenging. Next slide. And that might be because, you know, you have difficulty accepting help, or maybe you have to prepare yourself to accept help. Addressing problems as they come up. Sometimes it's really like you just don't want to have this conversation 100 times, and you know, going back to work, everybody's going to say something. So it might mean that you need to prepare what you're going to say ahead of time. Like, I've closed that chapter and I'm not willing to talk about that anymore, but what's new at work, or, you know, finding a way to kind of divert those conversations. And then, you know, accepting help. So people are in the sidelines just waiting to help out. And it might be, if you're returning to work or attending a social event, that you ally with someone and you express these feelings to someone ahead of time, so you know there's someone there who can understand you and help get you through that time. For sure, keeping up contacts during your recovery is important. It makes it easier to get back to people than feeling like you have to start all over again. And then again, planning what you'll say about your cancer if you're asked about it and maybe aren't willing to talk about it, or aren't willing to share certain things. So you have something you know you'll say to move the conversation along if you are in that position. Next is finding meaning after treatment. And so, you know, you're done treatment now, you've moved on into the survivorship phase. You may be heading back to work, or starting to socialize again, or starting to date again, or whatever it is. And you need to figure out what having cancer means to your life now. So you know that you might look at things or people in different ways. Things that were not important before might be really important, or vice versa. Things that were really important before, you may decide you don't have the time and the energy to put into those things again. Many people are going to reflect on their purpose in life, what they value most. And for lots, it's a time of increased spirituality. What we know for sure is adversity breeds opportunity. And so if you've gotten to the point of becoming a survivor after your cancer treatment, there are opportunities for you to be, you know, rewriting your next chapter. And that part is completely up to you. Next page. Change and strength are born here. This is the adversity that I'm talking about, the struggle that you went through, the time that you feel like you lost from your life to have to deal with a cancer diagnosis, or be out of commission for treatment, or the complications that came that extended things that you know, weren't intending to. This is where change and strength are born. It's super important to grieve the losses you've experienced, assess your life, talk to others who may have been in the same position, or may be the ones to support you. find the resources you need for whatever it is you're struggling with, and then find the new meaning of your life after cancer treatment. In terms of cancer program resources, we have psychosocial health services, and you'll hear more about this in the next coming weeks. There are learning resources around the center, and you can ask your team for very pertinent information. Canadian Cancer Society, which is available as paper copies or online, is an excellent resource. The Hospice of Windsor and Essex County is actually quite amazing, and they do some survivorship work. You don't have to have had an end of life experience with the hospice to use the resources that they have available in terms of coping with diagnosis, coping with treatment, and survivorship. They have excellent counseling resources and group sessions as well. And with that, I can open it up to any questions. I hope that we've given you some useful, first of all, some understanding that what you might be experiencing in your survivorship phase is actually quite normal, and you're not alone. And hopefully we've provided some useful tips for managing, or at the very least, what you need to address with your healthcare team in your follow-up visits, to know what's important enough to have a discussion and see what has potential, fixes, for lack of a better word. And so with that, I can open it up to questions if there are any. Also, you can put them in the chat. If that is easier, you can type them into the chat, and we can address them with everybody. So if there are no questions, just want to put another plug in for the next sessions that will be available to you. I encourage you to take advantage of those sessions. We will have some discussions by one of our social workers on sexuality and cancer, which is the next one next Wednesday. Same format as tonight. Just going to check the chat one more time. I don't see any questions. And so before I turn it back to Shannon, I just wanted to say thanks for being here tonight. I hope this content was useful for you, and I wish you all health and joy in your survivorship days.
All right, thank you, Kit. If anyone has any questions that they think of after the fact, feel free to email me. Oh, looks like there's something just a thank you in the chat. If you come up with any questions after the fact, feel free to send an email to renew@wrh.on.ca. I will also be sending everything via email, so you can respond to my email that way as well if you have any questions, and then we can try and get them answered for you. But if no one has anything else, we'll wrap it up for the evening. Please keep an eye out for the evaluation that will be coming probably Monday. Like I said before, that feedback is very helpful to us, and kind of guiding the next sessions to see if there's any helpful changes. But with that, I want to wish everybody a good evening. Oh, are you trying to ask a question, Dorothy? Gotta unmute. Oh. Oh, you're still muted, Dorothy. Sorry. I think she was trying to speak there, but it Not sure where Dorothy went there. If you do have a question, Dorothy, feel free to give me a call or send an email and I can pass that question along. But thank you everyone for a good session and hope to see you next week.